New research tells us what we should not do for any kind of spinal pain, whether it be at your neck or at your low back. This is coming straight from clinical practice guidelines out of the British Medical Journal. Now, these practice guidelines apply specifically to chronic spine pain, meaning anything that has lasted longer than 3 months. It also includes pain that travels down the leg, referred to as radicular pain, or when you commonly hear the term sciatica. Same thing for going down the arm. So if you have something that might be referred to as a cervical radiculopathy, really anything that is similar to or actually is some kind of entrapped nerve, those kind of symptoms, provided it's chronic, more than 3 months, apply in this study as well. The paper is not inclusive of acute pain, so anything less than 3 months, or pain that's caused by either cancer or inflammatory arthropathies. So let's look at the list. First up, we have injections of local anesthetics, steroids, or other combination into the cervical or lumbar region of the spine. Those are no-nos. We also have epidural injections of local anesthetics, steroids, or the combination. Then we have radiofrequency of dorsal root ganglion. We also have radiofrequency denervation of the cervical, which is neck, or lumbar facet joints, or the sacroiliac, commonly referred to as the SI joint. And lastly, we have paravertebral intramuscular injections of local anesthetics, steroids, or their combination. So, long story short, what this is really getting at is that injections are not the answer for chronic spine pain. Fortunately, there are things that we can do for chronic spine pain. This is not a comprehensive list of all the things you shouldn't do, by the way, and it certainly isn't taking away all the options that you could do to benefit treating chronic spine pain. Understand that when it comes to treating chronic pain, it is not a quick fix. It is something that is going to take a long duration of time, and there are a lot of potential causes, which is why you should go see a licensed professional. I am going to be biased because I am a physical therapist, but I do believe in the power of physical therapy or physiotherapy. I do think that having an allied health approach and having a multidisciplinary team can be very advantageous. Having a physician, whether that be an orthopedic or neurologist or some combination thereof, also having potentially mental health professionals, psychologists, if you're having any kind of anxiety or depression that can absolutely contribute to low back pain or neck pain, and even potentially a nutritionist or an exercise physiologist to get you on a great exercise program and diet program as well. Know that back pain is multifaceted, same with neck pain. There are many contributing factors, and there are a lot of ways to go about treating. We do have a lot of evidence that shows that conservative care are great treatment options. Getting multiple injections can be problematic. There are side effects with them. It can degrade or worsen the integrity and the strength of the nearby tissues that it's injected in, whether it be the bones or the ligament. Injections also don't fix anything. They are not going to help develop more muscle in the area. They're not going to strengthen your bones. As I said, it can do the reverse. And they're not going to address any of those other factors, those psychosocial factors that can contribute to chronic back pain. So while sometimes they might provide temporary pain relief, when it comes to chronic pain, they're not addressing any of the real root causes, and those should not be a preferred or really any treatment option for chronic back pain.